Dear Peresa, I'm happy to see you in Moscow. How are you?
I'm great. I'm having a wonderful time. People have been wonderful to me, so yeah, it's been a pleasure.
What do you think about Moscow, about our weather now, about people here?
It's a beautiful city. I had never been to Russia before, and I had studied so much about this country's history, so it's so nice to finally be here, and people have been so warm and kind to me, so I'm extremely thankful for that.
You see, I was been in Brazil more than 20 years, twice, I think twice or maybe 3 times. And in your country, very beautiful woman.
Yes, there are
What
beautiful
do you think
people
about
there.
Russian?
Also, very beautiful people here.
More blonde, yes?
Yes, Brazil has a history of immigration, so the ethnical variations is quite substantial, which is also very nice. You know, we have people from Asia, from Africa, all those influences come together, especially in the city that I live in, São Paulo, but which is, I find wonderful. And in Russia, it's so nice to see and study the faces of a very different setting of what I'm used to. So for me, as a person who likes to study faces, it's wonderful. People are absolutely beautiful here.
I like the same. When I come to Brazil, I will see all faces and thinking, what is it? Maybe Portugal, maybe Brazil, maybe. But you see, I have 2 clinics in Moscow and in Vladivostok. And in Vladivostok, I have a lot of ethnic variant of the China, Korean and Russian people. And this mix is so beautiful.
Yes.
Woman, so beautiful, so authentic woman with some variants of the eyes, Asian and European eyes, and the color of the skin. And that's why you see, when I thinking first time about laser, this is first question for me. If we're working with 3 or 4 types of phototypes of the skin, and may we do this or not? Because in Moscow we don't have such people, but not so, maybe have, but not so a lot. But in Vladivostok we have a lot of variant of the 3 and 4 phototypes. What are you thinking about the result for this phototype?
I mean, the situation in Brazil is we treat people from all phototypes, from 1 to 6, and I think that the technologies evolved in a way that we could do safe treatments throughout the whole year. And so not only the learning curve, but also the type of lasers that we do, for example, in Brazil, we always need to take into consideration that we live in a country that doesn't have seasons, basically. We have strong summer and not so strong summer, right? So there's sun throughout, you know, all 365 days of the year. So I think people were very afraid in the past to do laser treatments because of hyperpigmentation afterwards. And as the technologies evolved, we've managed to do very safe and effective treatments throughout the year with lasers. So yes, it's a...
Как вы думаете, в каком варианте меняется отношение врача к лазерным технологиям? И вообще меня вот, например, очень беспокоит не такое глубокое знание физики врачами. И на сегодняшний день Vydence, выходя на российский рынок, мы испытываем определенные сложности с тем, что такая мощная, интересная платформа, но она требует специального образования врачей. Вот как у вас обстоят с этим дела? Потому что, конечно, но это будущее, мы все это понимаем, что будущее за лазерными платформами.
I believe that in aesthetic medicine we have trends. So we went from very simple treatments with injectables to highly complicated treatments involving deep and superficial treatments with injectables. So there was this learning curve years ago of people going from nasolabial folds treatments to full face treatments with injectables. But we are in a situation now where doctors who are at a high level understand that there is a limit to what you can do with injectables, and injectables don't do much on the surface, right? So we're in a moment now in aesthetic medicine where technologies are taking over because you can do so much with them, not only for the texture of the skin, as most people thought that was the main purpose of technologies, but also for skin tightening and collagen and elastin stimulation. So I see the industry changing in a way that injectables are being less used. They're still an amazing tool, of course. We both use it a lot in our practice, but we've come to a moment where technologies take over in the long term. So maintenance, I mean, it's done mainly by technologies. And there's also a very difficult learning curve for those. So we're in a moment where you will see that the high-level doctors are the ones who understand the concept behind those technologies even before they buy a new technology. So yesterday during our talk, I was mentioning that if you understand wavelengths and if you understand the mechanism of action of each type of technology, the moment a new device is launched, you don't even have to try it to understand what its objective is. But there is a very difficult learning curve for that. And of course, you will differentiate experienced doctors from the lazy ones by how much they are willing to understand physics. So once you understand what goes on with fluency, wavelength, etc., you can set the patterns for the device to get the best results. So we live in a moment now where the learning curve is the main thing for us to get great results with technologies.
Ну, я хочу сказать, что платформа Vydence закрывает, например, практически, наверное, 80% потребностей практики, моей практики с пациентами в Москве. Может быть, как вы думаете, что в будущем, если мы начнем активно сочетать инъекционные методики, аппаратные методики, системную терапию, у нас будет больше шанса получать более выраженные результаты и при этом снизить реабилитационный период? Потому что сегодня это, наверное, самый такой важный запрос пациента, чтобы реабилитация была минимальна.
Well, I've been working with this platform for the past 8 years. In Brazil, I have a very strong clinic with 4 or 5 people working together with me, with my patients. And the necessity of having a lot of different technologies is reduced when you have a platform with a lot of handpieces that you can go from very short downtime treatments to very long, powerful treatments, long downtime treatments, where you have a recovery period that is longer, but you get amazing results from it. So what I see nowadays in my practice is that the combination of injectables and a maintenance with technologies will do pretty much everything that I need, will satisfy my patients' complaints fully. So being able to do so many different treatments, we are literally talking about infinite combinations when you consider different settings for each handpiece and how many handpieces you can work together in one session. We can create really amazing results.
Для нас Vydence новая платформа. Вообще компания Vydence для России новая. И, конечно, пока вызывает очень много вопросов, потому что монстры, которые предлагают аппаратуру, есть, которые в России давно и которые мы знаем. И я могу сказать, что я вчера, услышав сообщение коммерческого директора, поняла, что истории Vydence больше 40 лет. И вот вы сейчас сказали, что работаете с лазерами 8 лет. Как вы думаете, все-таки будущее за платформами лазерными или все-таки за отдельными лазерными технологиями? Потому что в моем представлении, в принципе, уже период, когда мы пользовались отдельными лазерными технологиями, заканчивается. И будущее, которое сегодня уже есть, это все-таки платформы. Но Vydence к этому готовился 40 лет. То есть это значит, что они сейчас уже имеют такой огромный опыт работы с сочетаниями, с протоколами сочетания, которых у других нет.
I am very fortunate to live in a country where two things really stand out: aesthetic medicine and engineering. So now the biggest company in with airplanes is Brazilian, right? So engineering is really big in Brazil. We have really good engineers. And aesthetic medicine, we both know that Brazil stands out as one of the top countries for that matter. And I am very fortunate to practice in a country where we can get devices from everywhere we want, right? So we have American companies, Korean companies, and a very strong Brazilian company battling for the market. And Vydence has done such an amazing work. It is probably the most sold platform in the country, and it's a very robust technology. So I mentioned yesterday that the handpieces that I bought 8 years ago that are used every single day, 12 hours a day, they function perfectly well, right? And we also live in a country where people have to pay very close attention to how much they spend on technology. So I think the scenario in the United States, for example, is a little bit different because the abundance of influx to the clinic, it's much easier. So the doctors don't have to think so much about how much they're spending, and they end up buying a lot of dedicated devices. But in Brazil, we have this situation where maximizing profit is mandatory, and also using space of the clinic in the best way possible. And I think that this is not a trend. This is something that has come to really take over the market. Not many companies developed platforms. In the beginning, it was more like that. But the companies who build nowadays very strong, robust, reliable, and effective platforms are really taking over because the cost benefit is really good. And also, you are more versatile. So I wouldn't change my platform for 1 or 2 or 3 dedicated devices because I can do much more personalized treatments having a platform. So not only from a commercial perspective, it's better, but also from a medical perspective, I find it much better.
Согласна. В Бразилии очень активно развита пластическая хирургия. И я когда была в разных сейшенах и просто на пляже, как доктор привыкла, конечно, оценивать разное состояние тканей, объемов пациента. Это уже такой профессиональный автоматизм. Я могу сказать, что много людей прооперированы. Кто-то тело, кто-то лицо и тело. И у вас пластическая хирургия очень активно развита. В России тоже пластическая хирургия достаточно развитое направление. И я могу сказать, что у нас часто пластический хирург соперничает с инъекционными и аппаратными методиками косметолога. Как у вас с этим обстоят дела? Как вы к этому относитесь и Считаете ли вы, что эти два направления, пластическая хирургия и эстетическая косметология, можно поженить их? Или все-таки они будут продолжать соперничать?
Yeah, we have a very similar situation for that matter between Russia and in Brazil, where not only aesthetic medicine, non-invasive or less invasive treatments are huge, but also plastic surgery is huge. And I believe that if you are a confident doctor, doesn't matter if you do surgery or not, you will provide what's best for your patient, and the things that are not in your expertise, you will delegate to your colleague, right? So of course I have nothing against plastic surgery, on the contrary, and I tell my patients sometimes when they come with a complaint and they are afraid of surgery, but their complaint is obviously a surgical one, I'll tell them, you need plastic surgery, right? There's nothing wrong with that.
The same as I.
Exactly. There's nothing wrong with that. And I always tell my patients that plastic surgery removes skin, and of course they can touch and repair
Lifting.
Muscle tissue, etc. They don't improve the skin, right? So no matter what the surgeon does, they're not going to improve the skin quality. That's our mission. And no matter what we do, there are some things that cannot be solved without plastic surgery. So I think that they go together really, really well if you're in good hands.
Совершенно согласна. И я могу сказать, что у нас в России пул молодых пластических хирургов часто, к сожалению, хайпует очень много на том, чего не понимает. А технологии лазерные, они требуют, конечно, знаний. А вот пул взрослых хирургов, которые оперируют уже больше 20-25 лет, они как раз за то, чтобы пациент после пластической хирургии переходил в руки эстетической медицины и работать с рубцами, работать с качеством кожи, с пигментацией, с поствоспалительными процессами. Они рекомендуют врачей, которые работают на той же платформе Vydence. У меня в клинике хорошо развито направление реабилитации. И мы активно с этими пациентами работаем. И я вчера видела у вас на слайдах прекрасные результаты после мамопластики, работы с рубцом. Вот мы тоже все это постоянно делаем. Поэтому я уверена, что в будущем все-таки, скажем так, люди отрицают то, чего не знают. И поэтому в моем представлении нам нужно как можно больше просто общаться с хирургами вместе и обмениваться тем опытом и той информацией, которая есть. Поэтому я даже задумала, чтобы провести круглый стол для пластических хирургов у себя в клинике, показать им платформу Vydence, показать все, что она умеет делать, для того, чтобы они рассчитывали на мою профессиональную помощь.
I think one of the things that really stands out for me when I talk to a colleague, no matter what they're specialized in, what stands out for me is their ability to work in a multidisciplinary way. So nowadays, in my routine, the best urologist in Brazil, the guy who's publishing everything, he sends me male patients to the clinic after he does prostatectomy so that they can have a better result in rehabilitation. So he's sending me patients, a urologist. One of the top orthopedic surgeons, not even plastic surgery, one of the top orthopedic surgeons in Brazil who does hip reconstruction, which we know it's super hard, the scarring is always bad because there's a lot of movement of the skin in a difficult area. He sends me patients to improve the scar tissue afterwards. So recognizing where your limits are in your specialty, it's not a weakness, it's strength. The same goes for us. When a patient comes to us saying that they want to improve their eyelid skin quality, and we see a level of skin laxity that will not be fixed with technologies, it's our responsibility to send that patient to a colleague who will do a blepharoplasty. By doing that, we keep the patient. We are not sending the patient to another person and keeping in mind that they're going to continue their treatment with another person. It's important to understand how multidisciplinary work is a strength and not a weakness.
Ну и последний такой крайний вопрос, который меня очень интересует. Скажите, вот вы все-таки 8 лет работаете на платформе. Назовите мне наиболее интересные HD-протоколы, которые вот вы бы сказали точно, надо с них начинать. Они самые интересные и самые результативные. Вот ваши любимые протоколы.
It's something that I don't even have to ask you because I already know the answer. All the time we have patients coming to our clinic saying, all I want is this.
Yes.
You know, and I'm
This.
complaining about this area. You know, that's our nightmare.
Yes.
Because patients think that we're going to do a very mild procedure on this
Only this?
specific area, when in fact we're going to get the best results for this area when we treat everything else, right? So it's a very common thing in our practice to have patients coming and saying, I just want this or this, right? And technologies have been our answer to those complaints, because as experienced injectors, we know that this idea of filling the lateral part of the face as an answer to all the lifting effect that we want to create doesn't really work in the long term. So combining fillers with technologies is mandatory. So what I've been doing in my practice quite often is a combination of different wavelengths. So ND-YAG laser goes really well, especially for the neck and the lower face for skin tightening. Then we can add a little bit more result if we do the in-lift treatment with erbium laser, which is super mild and comfortable treatment that goes together with it intraorally. Also, the true lift tip is also very good for skin tightening of the eyelid. And of course, we can go way above that with erbium laser for skin quality improvement of the eyelid. But those two technologies for skin tightening are very good. If you have available the infrared tip that also goes together, so you can combine different depths of treatment with no downtime, which is amazing. So for skin tightening, that is a very good protocol. And within 2-3 sessions, the patient will really see a difference, especially with thin skin, people who have a lot of laxity. They will see the results after the first session, but especially after 2-3 sessions, they will start to understand how important it is to have a maintenance with technologies to keep that skin lifted.
Огромное спасибо за беседу. На самом деле, оказывается, мы очень похожи. И несмотря на то, что мы живем на разных континентах, у нас с вами очень похожий взгляд на эстетическую красоту, на медицину эстетическую. У нас очень похожие по запросу пациенты. И я вас приглашаю много-много раз приезжайте в Россию, потому что мы очень активно развивающийся рынок, и мы хотим общаться, мы хотим делиться опытом, мы хотим обмениваться знаниями. И мы, конечно, хотим иметь такие крутые машины, как Vydence у нас, для того, чтобы наши пациенты тоже получали самые лучшие результаты.
Well, it's been an incredible honor, as always. I always learn so much from you, so thank you so much.